What made me want to go into medicine was just the aspect of helping people, and I've always been interested in nutrition. I've always been interested in food. Started out as an interior design major, and it just didn't work out, and I went to with my friends, and they were studying for an exam for health, and I realized that I knew all the answers and I wasn't even in the class. And so I went to my the professors and said, I think I want to change my major and do something with nutrition and science. And so it's kind of an interesting, non-conventional way of getting into it. I was working as a clinical dietitian at Community East and was ready for a change, and I saw that there was a position open and talked to one of the other dietitians who was already here about the job, what she liked about it, and the fact that you have follow-up with patients and you create relationships with the patients really called out to me. Because in clinical you see somebody once, maybe twice, and then they're gone. And with bariatrics, I see people from the very beginning when they start the journey all the way to the point where they're years and years out from surgery. And it's great to have that relationship and to know that they trust you and that you've made a difference in their life. Outside of work, I teach dance classes, tap, jazz, and ballet, and that's something that has been a part of my life since I was 4 years old. I'm also involved in my church, St. Joan of Arc in Indianapolis, and my fiance and I are working on buying a house and getting that all situated and put together and starting that life. Typically what we do in the first visit, it's called a diet evaluation, and it's something that we sort of go over in the initial seminar when a patient first comes to learn about surgery. We give them kind of a heads up of what to expect, but in the actual diet evaluation, we go over what the expectations are for surgery, the changes that they'll have to make in their diet and their behaviors before surgery as well as after surgery. We go through some labs and give them a lab order so that they we can see if they have any deficiencies prior to surgery, get those corrected before it's too late and a little bit more difficult to improve those lab values after surgery. We go over the different surgeries and kind of what to expect with the nutrition in terms of how much they're eating, vitamins, what types of foods they're eating, and so on and so forth. And then we also provide them with a food log, food journal, that they are asked to keep with us over the course of their pre-op time, as well as preoperative diet, which we have them follow 2 weeks before surgery to just help with portion control, help with liver reduction, and just really getting into what their diet's going to be like after surgery. The first time that I will have any interaction with a patient is typically at the seminar. Just when someone has an interest in surgery, they come to our informational seminar. Our nurse is there, one of our surgeons, one of our insurance coordinators, as well as a dietitian. And so we introduce ourselves at that point. And then the first time they really have one-on-one interaction is at that initial diet evaluation. I think advice that I would give anyone who's just considering bariatric surgery is to evaluate your diet right now, because it's going to change. And it might be hard, but typically there are things that can be changed, things that you may not want to change, things that you may not necessarily be willing to give up, but you have to weigh those options. Is it worth it for you to be happier and healthier? It's not all about the weight loss, and in my eyes, success is being happy and being healthy. And if you're happy and healthy, I don't care what weight you are, you're successful. A lot of times people will say, oh, well, I don't want to get down to a size 4 or size 2, or they say, I do want to get down to that. And that's not really the ultimate goal. The ultimate goal is for you to be happy and for you to be healthy and to be able to do things that you couldn't do before.